So, dear students, today we are discussing about the railway pharmacist exam previous year questions. So we are discussing. Um, we are discussing the first question. Mode of transmission of pertussis. इसका आंसर होगा ड्रॉपलेट इन्फेक्शन. Mode of transmission of pertussis. Option A, vendor transmission through contaminated water, droplet infection and fecal. तो उसका आंसर है ड्रॉपलेट इन्फेक्शन. Time required to measure the Mantoux test is the answer of this question is 48 to 72 hours. Option A 24 to 48 hours. Option B 48 to 72 hours. Option C 10 to 12 hours, and option D is 2 to 4 hours. The answer of the question is option B 48 to 72 hours. Question number 3. Name of the oral polio vaccine. Option A BCG vaccine. Option B TAB vaccine. Option C Salk vaccine. Option D Sabin vaccine. तो उसका the answer of the question is option D Sabin. Let's discuss the question number 4. The following of the are the standard tuberculosis drugs except में मतलब जो नहीं है उसके अंदर में वही ड्रग्स है. तो क्लासिफिकेशन में ट्यूबरकुलोसिस के अंदर जो ट्रीटमेंट के लिए जो ड्रग्स यूज होता है वो स्ट्रेप्टोमाइसिन, पैरामिनोसैलिसिलिक एसिड. ऑप्शन डी. ऑप्शन सी आइसोनियाजाइड. तो ऑप्शन ए होगा इसका आंसर क्लोरोमाइसिन, जो कि स्टैंडर्ड ड्रग में नहीं है. कॉम्बिनेशन ऑफ ट्रिपल एंटीजन इज डीपीटी, बीसीजी, ईसीजी, टैब. डीपीटी होगा इसका आंसर. द क्वेश्चन नंबर 6 इज द टाइम इंटरवल बिटवीन इन्फेक्शन ऑफ सस्पेक्टेड पर्सन एंड द appearance of signs and symptoms of disease is called. The time interval between infection of suspected person and the appearance of signs and symptoms of the disease is called as incubation. What is the meaning of the question is, so the interval between infection of a suspected person, जो जिसका इन्फेक्शन जिस पर्सन में पाया जाता है, सपोज यू हैव टू गॉट सम डिजीज एंड उसका जो आता है क्या सिम्टम्स वगैरह स्टार्ट होता है, एंड जो वायरस वगैरह या फिर बैक्टीरिया जो हमारा बॉडी में जाता है, बॉडी से जाने से स्टार्टिंग से हमारा सिम्टम स्टार्ट होने तक जो टाइम रहता है पीरियड को, उसे क्या कहा जाता है? इंक्यूबेशन पीरियड कहा जाता है. आइसोलेशन पीरियड क्या होता है? जो कोरोना टाइम में हम आइसोलेट करके रखते हैं, पर्सनल एक सेपरेट रूम में रखते हैं, उसे आइसोलेशन. रिकवरी पीरियड मीन्स मेडिसिन स्टार्ट होने के बाद ही वो उसका पीरियड स्टार्ट होता है, रिकवरी पीरियड. एंड क्वारंटाइन पीरियड होता है, जो कोरोना के टाइम में जो हुआ था, जो सब लोग को एक साथ में क्वारंटाइन में रखते थे, जिन लोगों को पेशेंट लोगों को सबको एक साथ में रखते थे, तो इसे क्वारंटाइन पीरियड कहा जाता है. रूट ऑफ ट्रांसमिशन ऑफ हेपेटाइटिस बी इज ऑप्शन ए ओरल, ऑप्शन बी पोटेंशियल, ऑप्शन सी फोको ओरल, ऑप्शन डी contaminated water. The right answer of the question is potential. Route of transmission of hepatitis B is potential. Mode of transmission of typhoid fever is question number 8. The mode of transmission of typhoid fever is option A intravenous, option B aerofocal, option C respiratory, option D droplet. So the answer of the question number 8 is option B aerofocal. 9. Question number 9. Causative organism of diphtheria is option A mycobacteria, option B streptococcus, option C Corynebacterium diphtheria, option D staphylococcus. जो the answer of the question is partially same to the question is that is diphtheria. The Corynebacterium diphtheria, and the question is the organism of diphtheria. So the answer is likely easy to answer it. Question number 10. Incubation period of measles is option A 1 to 7 days, option B 7 to 14 days, option C 14 to 21 days, option D is 21 to 28 days. So the answer of the question number 10 is option B 7 to 12, 7 to 14 days. Question number 11 is site for Mantrax test is question number option number A. Option A is outer and upper quadrant of gluteus maximus. Option B deltoid region. Option C posterior left forearm. Option D anterior left forearm. So the answer of the question on option number D is anterior left forearm. Media of transmission of bovine type of tubercle bacilli is media of transmission. How to transmit the bovine bacteria and tuberculosis is bacilli में so the option of the question A is milk, option B water, option C air, option D food. So the right answer of the question is option A milk. C painful maturation is option A enuresis, option B dysuria, option C retention of urine, option D diarrhea. So the right answer of the question number 13 is dysuria. Amount of solution used for evacuant enema is in adults. The amount of solution used for evacuant enema in adults. Amount of solution used for evacuant enema in adults. Option A 100 to 250 ml. Option B 250 to 350 ml. Option C 500 to 1000 ml. Option D 1000 to 1000 ml to 1500 ml. So the right answer of the question number 15 is option C 500 to 1000 ml. The amount of solution used for evacuant enema in adults is option C 500 to 1000 ml. So next question is question number 15. Drugs used to relieve pain is option A anti-inflammatory, option B antipyretic, option C antibiotics, and option D anti-analgesic. So the right answer of the question is option D anti-analgesic. The definition of analgesic is the drugs which are treatment and cure of relief of pain is called as analgesic. So the next question is question number 16. Hormone secreted by the testis is androgen. Option A estrogen, option B pitocin, option C androgen, option D progesterone. The right answer of the question number 16 is C androgen. 17. 1 teaspoon contains 5 ml, 2 ml, 10 ml, 15 ml. So 1 teaspoon contains 5 ml. Question number 8. 1 ml contains dash drops, 1 ml contains 5 drops, 10 drops, 15 drops, and 20 drops. So the 1 drop contains dash drops, it is 15 drops. Average weight of newborn baby is option A 2 kg, option B 4 kg, option C 3 kg, option D 5 kg. So the right answer of the question number 19 is 3 kg. Average weight of newborn baby is 3 kg. So the next question is question number 20. How much salt must be added to 1 liter of water to make a solution of normal saline? Option A 2 grams, option B 5 grams, option C 6 grams, and option D is 9 grams. So the right answer of the question number 20 is 9 grams. Because of this, the 1 liter of the solution in water and the normal salt is 0.9%. That means 9 grams of salt taken in 1 liter of solution. Question number 21. Number of vertebrae in sacrum is option A 5, option B 3, option C 4, and option D 1. So the right answer of the question number 21 is 5. Question number 22. Number of chromosome in a cell 60. The option is 44, A 23, B 46, D 40. The right answer of the question is 44. A trial spectral defect occurs due to the persistence of dash. Question number A, option number A, Foramen B, ductus arteriosus, option C, ductus venosus, option D, mitral valve. So the question repeat. I will repeat the question. Atrial spectral defect occurs due to the persistent of dash. It is the right answer of the question is ductus venosus. Question number 24. Dash is a water soluble vitamin. Dash is a water soluble vitamin. This is the answer of the question is vitamin B and C are the right answer. So the option is given by the question is maybe it is vitamin B, the right answer of the question. And A, D, K are the lipid soluble vitamins. 25. Quickening means hearing of the fatal heart sound. Option number B, sudden cessation of menstruation. Option number C, the movement of the fetus in the uterus felt by the mother. Option D, nausea and vomiting in the morning. So the right answer of the question is the movement of the fetus in the uterus felt by the mother is quickening. 26. Cholera is caused by a kind of bacterium called tuberculosis, that is tubercle bacillus. Cholera is caused by kind of bacterium is called tubercle bacillus, not tuberculosis. Option B, Vibrio cholerae. Option C, protozoa. Option D, Entamoeba histolytica. So there have been a mistake in option question number 26. The right answer is Vibrio cholerae, not tubercular bacillus. This is answer Vibrio cholerae. The right answer is Vibrio cholerae, not this tubercle bacillus is the wrong answer. So the right answer is Vibrio cholerae, option B. So after the question number 17, drinking of alcohol will severely affect the liver. Liver is the right answer. The disease in which the patient's blood does not clot easily is hemophilia. So hemophilia is a disease. The patient bloods are not clot easily. Hemophilia. (29) Discoloration of teeth is caused by which kind of antibiotic? This is tetracycline is the right answer. Question number 30. Dash is caused by the fungus. Athlete's foot. The filariasis is transmitted by dash. Filariasis is female Culex mosquito, and malaria is आंसर कमेंट में बताओ. व्हाट इज द filariasis is caused by dash and malaria is caused by dash. मलेरिया कौन सा मॉस्किटो कामने से होता है वो कमेंट में बता दो. एंड द फाइलेरियासिस का आंसर राइट आंसर फीमेल क्यूलेक्स मॉस्किटो. 32. The blood group contains no antibodies. AB contains no antibodies. Any option is the blood group contains no antibodies. Suppose the question is the blood group contains B antibodies, the right answer is A. उसका ऑपोजिट में आ जाता है. एंटीबॉडीज मीन्स उसका ऑपोजिट एंटीजन ए में एंटीबॉडी बी पाया जाता है. तो इसका ऑप्शन ऐसा रहेगा. सो द ऑप्शन बी में क्या होता है कि द ब्लड ग्रुप कंटेंट्स ए एंटीबॉडीज दैट इज बी एंड द both AB is answer is O and no antibodies is answer is AB. 33. The disease that spreads through sexual contact is called as AIDS. 34. Typhoid is transmitted through water and food. The right answer. Question number 35. This is the example of disease caused by bacteria. This is typhoid. Question number 36. This is the immunity get by the body after first attack of disease. Acquired immunity. Acquired immunity. This is the immunity get the body after first attack of disease. This is acquired immunity. Question number 37. The cells that are responsible for the production of antibodies are white blood cells. The cells that are responsible for the production of antibodies are white blood cells. The cells that are responsible for the production of antibodies are white blood cells. 38. A healthy person can donate blood or times a year. That is the answer of the question. Right answer of the question is 2 or 3. The healthy person can donate a blood in a year. That is 2 or 3 times. The minimum is 2 and maximum is 3 times. The question number 39. Radioactive cobalt and radium are used for the treatment of which disease? That is cancer disease. Question number 41. 40. World Health Day is celebrated on April 7th. Question number 41. To relieve from dyspnea and appreciate positions to be used is Flora position. Question number 42. Protein requirement for a pregnant woman per day is 55 grams. Protein requirement for a pregnant woman per day is 55 grams. Question number 43. The fundus is at the level of umbilus during weak pregnancy is 24. The total weight gain during pregnancy is 13 to 14 kg. The total weight gain during pregnancy is 13 to 14 kg. 45. The birth weight of the baby doubled at the age of 6 months. The birth weight of the baby doubled at the age of 6 months. 46. Fantasy infancy period is from infant period is from 1 month to 1 year. Question number 47. The following are the sign of dehydration except sunken tearless eyes, loss of skin elasticity, Question option C, diuresis. Option D, depressed mentally. So option C, diuresis. 48. The following are the contents of ORS except calcium carbonate. The following are the contents of ORS except A, sodium chloride, B, sugar, C, potassium chloride. Option D is calcium carbonate. So the right answer of the question is calcium carbonate. Question number 49. The most common form of malnutrition are the following except A, beriberi. The most common form of malnutrition are the following except beriberi. Question number 50. The first course of oral pills should be started on the day of menstrual cycle, 5th day. The first course of oral pills should be started on the day of menstrual cycle, 5th day. The first course of oral pills should be started on the day of menstrual cycle, 5th day. The following are the natural method of contraception except foam tablet. The following are the natural method of contraception except foam tablet. The following are the natural method of contraception that is except foam tablet. So the answer is basal metabolic temperature, rhythm method, safe period. So the right answer is foam tablet. Foam tablet is chemical method, that is natural method. Natural method is rhythm method, basal metabolic temperature, and safe period. 52. Question number 52. Dash is the permanent method of sterilization, tubectomy. The following organs are situated in the abdominal cavity except oesophagus. The system of body which helps for the removal of waste matter from body is excretory system. Total number of bone in human body is 206. Eruption of teeth started at the age of dash month 6 months. Eruption of teeth starts at the age of dash month 6 months. The nerve which carries messages from the brain and spinal cord muscle and glands. The right answer is motor nerve. 58. Speech center is situated in parietal lobe. 59. Largest gland in the body, liver. Head control of the infant occurs at the age of 5 months. Head control of the infant occurs at the age of 5 months. Puerperium is the period begins as soon as the placenta is expelled and lasts for 6 to 8 weeks. Puerperium is the period begins as soon as the placenta is expelled and lasts for 6 to 8 weeks. When the umbilical cord lies in front of the presenting part and the membranes are intact, it is known as cord presentation. Starting of menstrual cycle is called as menarche. Menarche and menopause होता है the last of menstrual cycle. 64. Normal blood urea level is 20 to 40%. 20 to 40 mg%. 65. 1 gram carbohydrate yields 4 kilocalorie and 9 होता है 1 gram of lipids या फिर triglycerides. 66. A method of making the victim of breath passively is artificial respiration. Question number 67. Minute the walled blood vessels between the end of the arteries and beginning of the veins is called capillaries. The walled blood vessels between the end of the artery and the beginning of the veins is called capillaries. A waste gas produced by the body and exhaled through the lungs is called as carbon dioxide. A waste gas, which gas is expelled out from the body through the lungs is called as the gas is a carbon dioxide. 69. The condition characterized by moving of a bone out joint is dislocation. A tube of muscular tissue carrying ingested food from the mouth to stomach is oesophagus. A tube of muscular tissue carrying ingested food from the mouth to stomach is oesophagus. Which tube is containing the starting from mouth to stomach is oesophagus. 71. A red pigment in the blood cells which combines with oxygen and carbon dioxide for carrying them, hemoglobin. Information given by the sufferer about his illness is symptom. What is the symptom of patient is illness and suffer about his pain, or sign means what? Sign and symptom. Sign means what? The sign means comments में बताओ what is the sign. 73. Normal respiratory rate in adults is 16 to 20 per minute. Normal respiratory rate in adult is 16 to 20 per minute. The normal body temperature is 37 degrees Celsius. Characteristic of the blood flow due to arteries bleeding is following except dark red in blood, dark red in color. Characteristics of the blood due to arteries bleeding is following except bright red in color. Response is carcinogenic of heart flow is pulsatile and dark red in color, bright red in color. Due to arterial bleeding is following except which dark in red in color. Is the wrong answer. Bright red in color is the right answer. Okay, so the option is D for 75. 76. An agent that has the power to kill microorganism is बैक्टीरियोसाइड. किल माइक्रोऑर्गेनिज्म. बैक्टीरियोस्टैटिक में क्या होता है? किल द बैक्टीरिया होता रहेगा. बैक्टीरिया जो होता है वो बैक्टीरियोस्टैटिक रहेगा. 77. Strength of Savlon for cleaning up wounds is strength of Savlon for cleaning up wounds is 1:10. 78. Inflammation of the tongue, glossitis. Inflammation of the tongue is glossitis. 79. Following are predisposing cause for bed sore except anorexia. Question number 80. Inability to sleep is termed as insomnia. Question number 81. Tobacco contains a poisonous substance is called nicotine. Question number 82. A disease caused by allergic disease is called asthma. An adult has dash liter of blood in his body, 5 to 6 liter of blood in his body. Several persons in a town got the attack of leukemia. Which of the following can be possible? Exposed to radiation, not all major substances. Exposed to radiation, the primary answer. The energy value of dash is more than that of others. Fat. The product formed with when amino acid molecules combine together is called as a protein. Women having normal limbs may sometimes give birth to baby with deformed limbs. This must be due to mutation. Hormones are transported to all parts of the body through the blood. Deficiency of dash in blood, deficiency of dash in food cost simple goiter, iodine. Cortisone is used as a effective anti-inflammatory drug in the treatment of arthritis. Cortisone is used as effective as anti-inflammatory drug in the treatment of arthritis. Deficiency of thyroxine in adults leads to a condition called myxedema. Question number 92. The hormone that is injected to pregnant women at the time of delivery is oxytocin. The outer layer of the eyeball is conjunctiva. The outer layer of the eyeball is conjunctiva. The outer layer of the eyeball is conjunctiva. The smallest bone in the human body is stapes. Central nervous system include the spinal cord and brain. Short-sightedness can be corrected by using spectacles with dash lens, concave lens. In concave lens, short sightedness जिसे बोलते हैं, and in concave, in convex, and in convex the some large distances also or long distances. In question number 97, normal sugar level in our body in our blood is dash 80 to 120 ml per 100 ml, 120 mg per 100 ml. Labor takes place after days of last menstrual period. Labor takes place after 280 days of menstrual period when the childbirth is in that days labor happens. Signs for true labor are the following except fetal moment. Sign of separation of a placenta are the following except temperature rises. Sign of separation of placenta are the following except temperature rises. So we have to complete our this session, and we are after this session. So all the students are required to like, share, and subscribe this channel for any other and important topics we are giving in this channel. Thank you very much.